Welcome to another episode of Doodly. This is basically a follow-up episode to the previous one about the Venturi nebulizers. I'd missed out mentioning certain important points, so I'm going to cover those things in this one. This would basically cover certain practical problems you might face while using these nebulizers, the reasons which would explain why these problems are happening and how to circumvent. We will list these one by one subsequently. So the first of the problem you are likely to face is when you are likely to use oxygen flow meter rather than a compressed air device. When you use the oxygen flow meter, next time try keeping the flow below 5 liters and see whether this is able to generate aerosols or not. I'm sure you'll find it will not. As you increase the flow gradually, you'll start seeing that the aerosolization starts and you'll start getting good mist. So once you reach about 8 to 10 liters, you will find appropriate functioning of the device. So now the reason why this happens is, as we noted earlier, it depends on a pressure drop in order to generate subatmospheric pressure as well as aerosolization of the particles. So if the flow is not enough, so enough pressure drop cannot happen, as a result of which this whole process will not happen. What happens if you try increasing the flow above 10 liters? In all probability, the back pressure developed at the junction between the tubing and nebulizing chamber will make sure that it gets disconnected. The other common problem you are likely to see is everything is going on well. The nebulizing chamber is attached to a face mask which is strapped onto the patient's head. Intermittently, you might find the aerosolization stops. So, apart from the reason ensuring that there is enough fluid in the chamber, the other important reason which you can see this problem is if the nebulization chamber is not upright. So if the chamber is not upright, as highlighted in the diagram here, the fluid in the chamber tends to gravitate down. If the lower end of the capillary tube or the cap is not in contact with the fluid, the siphoning effect of the fluid does not happen and therefore aerosolization does not happen. So this brings us to the point that the nebulization chamber has to be absolutely upright in order for this to function properly. The next problem you're likely to see, especially if you're nebulizing patients using these devices, patient under anesthesia on an anesthesia machine or on a ventilator in ICU. The moment you start using these nebulizers, you would have noticed, or you would notice that the expiratory tidal volumes go all over the place. The ventilator would start alarming. The reason being is the extra volume being added from the flow used to drive the nebulizer, as well as the extra volume added due to the entrainment of additional air, which adds on to the exhaled tidal volume, setting off the alarms. On a different note, not as a function of the device used to nebulize, but the drug being added, whenever we add any of the respiratory medicines like either salbutamol or budesonide, you'll start realizing, especially if the patient is on an anesthesia machine and we have automated gas analyzers, they would start recognizing these agents as halothane. These devices are in quite widespread use. They're used quite a lot, be it in ICU ward or OTs. But unfortunately, they have a lot of wastage. Now, because the process of generation of aerosolization is driven by high flows as well as it's continuous, a lot of the aerosol is wasted, especially when the patient is not breathing in, either when patient is breathing out or in between breaths. That nearly accounts for about 50% of the wastage. But why do we still continue using these devices? It's mainly because they are quite cheap and easy to use. As noticed earlier, the functioning of this device depends on the Venturi principle and the capillary action. Because of the variations in the flow or the variations in the pressure drop, apart from this, it also has an implication on the generation of size of the aerosol. We know that the aerosol size needs to be less than 5 micron in order for the medicines to reach the lower airway. Because of the variations, either because of the flow or the pressure drop, almost 30%, up to 30% of the medicine can get wasted, not reaching the lower airway. This can be overcome by using an ultrasound based nebulizer or a vibrating mesh nebulizer. Explaining them would be beyond the scope of this video. Maybe another episode we can discuss about them. But this further adds on to the wastage of the medicines. I hope this was useful, and thank you once again. If you have any specific questions, please leave them in the comment section. We will try to address them.